Hi everyone, this is a channel to learn and treat with herbal medicine. Please register for channels to regularly update the latest news. Pelvic arthritis is a disease that can be encountered in anyone, but the incidence in women is higher than in men. The disease causes unpleasant aches and pains, seriously affecting the patient's life. This article will help you understand what pelvic joints are and how to treat the most suitor. BLE disease. What is pelvic arthritis? Pelvic arthritis is an inflammation of one or more joints in the position between the spine and pelvis. These joints are located in the lower part of the spine, which is where the pelvis is connected to the spine. It is because of its specific position that arthritis in this position often causes negative effects to belt, buttocks, hip. Legs can occur at one or both feet. Feet rare. Arthritis with the pelvis is a type of ankylosing spondylitis. Symptom. The manifestations of arthritis with the pelvis are the same as the problems at the waist. Pain appears much in the lower back, hips, and buttocks running down the legs. The pain is usually worse when climbing stairs, jogging, walking for long steps, standing in an extended position. May be accompanied by mild fever. Reason. The impact from external forces causes injury to damage the joint with the pot. Normally, patients experience a traffic accident, stumbling or injury when playing sports. Pregnancy. Joints in the pelvis during pregnancy will expand and last longer than usual to fit in reproduction. A sudden increase in body weight during pregnancy causes a change in gait due to increased pressure on the joint and pelvis, causing pain. Arthritis. Chronic osteoarthritis can cause arthritis in the pelvis or ankylosing spondylitis. Infection. In cases where the joints are infected, infection may be rare. Diagnosis of arthritis in the pelvis. To diagnose this disease correctly, doctors need to proceed. Check for symptoms you are experiencing and do clinical tests. The doctor will press on the buttocks, hips and move the legs to see the body's reaction. In some cases, the doctor will directly inject an anesthetic into the joint to determine the exact pain in the joint and the hip at the waist. However, the diagnosis in this way will often result in a low accuracy because the injection may spread to another area. X-rays are used to accurately examine lesions in joints and pelvis. If suspected ankylosing spondylitis, additional MRI magnetic resonance imaging should be performed. Treatment of arthritis in the pot. The treatment of arthritis with the pelvis has many ways, depending on the specific case of the patient varies according to the severity, but the method should be applied accordingly. Use OTC over-the-counter medicine. Over-the-counter pain relievers have the effect of reducing the intensity of pain caused by arthritis of the perineum such as ibuprofen, Advil, Motrin IB, or acetaminophen, Tylenol and some other drugs. However, the use of these drugs may cause adverse effects such as abdominal pain, liver and kidneys that are adversely affected, so you should consult your doctor before use. Drugs prescribed by prescription. Muscle relaxants or painkillers are prescribed by a doctor if the patient has frequent pain or spasms. The most commonly used drug is TNF inhibitor applied in cases of ankylosing spondylitis. Cold packs and hot packs. Cold and hot packs are an immediate way to reduce pain and arthritis pain. Patients should combine cold and hot to achieve the best effect. Rested. Rest and absolutely avoid activities that make the pain and pelvic pain more serious. Exercise. Performing exercises during and after the treatment process plays a role in promoting the body's ability to recover and preventing recurrence. The following are exercises that will improve arthritis with the pelvic. Exercise 1. Stretch your knees close to your chest. Doing. Posture is about to lie on your back on the floor, and your legs are wide open. Hold your knee and place your pillow on your chest, staying in this position for 5 to 10 seconds. When performing the movements, patients need to combine with exhalation gently, slowly, rhythmically. Take your foot back to the ground, then switch to the other leg. This action should be repeated 8 to 10 times. Foot. Rotate the pillow. Do as follows. In preparation position, stand up straight. Stooping back, Hands hugging knees and then turning the pillow in the direction from left to right clockwise. Switch side back from right to left clockwise. Perform a repeat rotation of 8 to 10 times. Push your butt up high. Exercises to treat arthritis in the pelvis help relax the lower back muscles and gluteal muscles to overcome inflammation in the joints and pelvis. Doing. Lie on your back and touch the floor. Bend your knees up. Hands placed along the body, left and right palms facing down on the floor. Raise your hips to the highest level to shape the bridge. Hold this position for about 5 seconds. Put your back gently on the floor. Performing repetitive movements pushes the buttocks 8 to 10 times higher. Living regime and scientific nutrition. In addition to taking drugs, practicing arthritis exercises with the pelvic, patients also need to pay attention to diet, living so as to suit the dis-ease situation. Supplementing full of nutrients that contain lots of calcium, especially fresh foods rich in vitamins D, B12, potassium, omega-3 fats, from plant sources will be very good for patients. Absolutely do not drink beer, alcohol, or other alcoholic beverages, smoke cigarettes. Perform regular physical exercises with gentle exercises persistently daily. Measures for treating chronic arthritis of the pelvis. Inject corticosteroids directly into the joint to control the disease. Electrical click on the joints and pelvic bone. The surgery will be considered by